Hello, welcome to the channel Nursing in Handy. The channel is preferably for the nursing fraternities and also the nursing students to improve their knowledge and also have a continuous learning in their profession. So today we will be dealing about one of the very interesting topic. Yes, as you have guessed from the topic, this is innovations in nursing. So why we need to learn about innovation in nursing? Because every profession has the advancement in their technology, whether their process or functions, innovations in the research. The same way nursing profession also has a innovation. So innovation is not only based on the technology idea, and also it deals with the nursing research, nursing management, nursing concept and improvement in all the aspects of nursing, whether in education or clinical practice or management. So we will be seeing it one by one. So the introduction: the only constant feature in the world is change. While all the change may not lead to progress, there can be no progress without change. So this is true for the individual, institution, organization or country. So civilization owes its existence to change. So from this it is very clear that every change may not lead to a progress. Yes, obviously, in the same way every progress, if it is taking place in any profession, means it has to be changed. So we are also come across from ancient times various changes in nursing. So we'll see definition of innovation. It is defined as a generation of new ideas or applications of existing ideas to a new situation, resulting in improvement in organization. The definition is by Mithun Kumar. The types of innovations is: one is product innovation and second is process innovation. So product innovation means what product we are going to give as an invention. For example, new inventions of ventilators, like that, that is product innovation. Process innovation means the way of functioning is known as process innovation. So these are the two types of innovation. One is product innovation, that is improvement or the invention in goods or services, and next is process innovation, that is delivery of method. That is significantly improvement in the production or delivery of method is known as process innovation. Next is need for innovation is global demands in health services, global workforce shortage, emerging clinic and nursing specialties, and maintenance of quality health services and improvement of quality of care. So these are the need for innovation. Next is principles. So innovation is to analyze the opportunities or sources. Innovation is both conceptual and perceptual. It should be simple and focused. Effective innovation starts small and they aim to do some specific thing. So successful innovation aim at best. So whatever we are getting the best, that is known as innovation. So what all innovations we have got in nursing education is: so handheld computers in nursing education, video conferencing and web based conferencing that connects the students and educators across the distance, connects diverse students groups, and e-learning. So in the recent times we are coming across the e-learning. From here we can learn in a global level. Even we can attend the workshops or e-learning workshops, seminars, everything from this part of the country to other parts. So we can connect easily. Globally we can connect with each other and learn. Next is global health education. So while sitting in the house you can acquire the education from other universities, that is known as global health education. For example, in India we are sitting here and we are being connected to the colleges of abroad countries like America or Australia. Like that, a global health education is being imparted to the students due to the development in technology, and that too in a nursing education. Next is service learning, that is structured learning experience that combines community service and preparation and reflection. That is service learning means in service we are going to learn, and also we are going to correlate the theoretical and practical knowledge. Next is high fidelity patient simulator. So in education we are using the simulation for learning. For example, we are having simulator for BLS, basic life support. So it will intimate you whether you are giving proper CPR or not, like that. Next is teleteaching and micro-teaching. So teleteaching means learner-oriented learning, promotes discovery learning. So here the interacts with the tutor takes place. That is education and learner directly interact with each other. So micro-teaching means every student will have a less attention towards their education. So to get the full attention we are giving micro-teaching. Next is nursing informatics, that is involvement of the computers in nursing education to support the nursing practice, nursing administration, nursing education and nursing research. So computer has come across in all the education, so we are also including that in nursing profession. So nurse certification, so each and every we are being getting the certification, and we are getting specialization in each and every corners of nursing. For example, I'm telling neonatal resuscitation program, pediatric advanced life support, cardiothoracic nursing. So we are getting a specialized nursing in our profession, that is known as nursing certification. The certification course for a qualification, that is advanced qualification in our nursing. Next is staff and student recruitment. So new methods like OSCE and OSPE is being implemented in the nursing education. That is objective because examiner use a checklist for evaluating the training, whether the trainee has acquired all the criteria being there in the checklist or not. That will be assessed, especially in the clinical aspects, whether the person follows the preceding steps one by one. For example, in nursing process, we do first nursing assessment, then do a planning, next do a diagnosis, then do a planning. Like that, whether nurse goes in a continuous manner or not will be assessed in the OSCE and OSPE. So we are introducing those methods in our nursing education also. So, and also to reduce the gap between the desperate need for nursing information and its availability. So next is innovation in clinical practice area. So far we have seen about the education. Next we'll see about the clinical practice area, that is computer assistance. So we are using the computers for maintenance of health records, high security cards, use of robots in all the nursing cares, and also in surgeries also we are introducing the robots. And in the same way, wireless technology, nurse have immediate telephone contact with the employees and the patient. So these all are the new innovations in nursing. In nursing as well as in the medical field for the patient. So we are all working for the patient. In the same way, next innovation is evidence based nursing practice. So from when you just compare with the ancient times, now and all we are just following the evidence based nursing care. So our main intention is to follow all the scientific principles. So each and every movement of the nurse requires the rationale. For example, I am just giving IM injection, so it should have a rationale for what purpose I am giving IM injection. Same way, job description. So for each and every nursing fraternities, we have a job description. So based on that, we work accordingly to fulfill the institutional, that is educational or healthcare institutional goals. Next is triage. So triage has become mandatory in the accident and emergency, and thereby are able to prioritize the patient who come to casualty. So before and all it was not there, and now and all we are following the triage management in our nursing education and nursing practice. Next is ethics. We have to follow all the ethical principles of the nursing in order to boost up in our education and also in the profession. That is, we have to follow the ethical principles like fidelity, veracity, confidentiality, autonomy, and what non-maleficence, beneficence, like that. So next is forensic nursing. So we are getting specialized in other aspects of nursing also, that is forensic psychiatric nurse, that is they work with the mentally ill offenders and with the victims of crime we are working, and also the trauma conditions we are working with the patients. Next is telenursing. So in the COVID era, we are coming with the telenursing, from sitting from other part of the country, we can also give the nursing care to the patients in the other pole of the country, that is known as telenursing. Next is hospice nursing. Nurse works holistically with clients and family members. So even with the family members we give counseling, that is a hospice nurse. Next is case manager nurse. In case of any problem is there, we have to sort out those problems, and we act as a case manager nurse. Next is nurse researcher. So nurse researcher and nurse educator is a newly emerging job description in our nursing profession. So nurse researcher who do evidence based nursing practice and do a continuous research to identify the best nursing care for the patient. So this is the nurse researcher and nurse educator. Next is telephone triage nurse. So telephone triage nurse means through the telephonic conversation will identify the emergency medical management of the patients. Next is parish nurse, the nurse who just believe on their beliefs, values, practices of various faith communities. Next is nurse practitioner, and nowadays there are also a independent nurse practitioner is being emerging out from midwifery and the pediatric aspects. Next is clinical nurse specialist. For each and every clinical specialties we have a nurse like pediatric health nurse, community health nurse, geriatric health nurse, and obstetric and gynecological nursing. Like that, we have a specialization in our nursing profession. The same way, Innovation in administration management is main is use of computers, that is computerized physician order entry, clinical decision support system. So electronic medical records. In electronic medical records means if for example, if a patient is coming into the hospital, the patient is getting one IP number. When we type those IP number in the computer, we'll come to know where and all the patient has come, what and all diagnostic evaluation the patient has underwent. That is known as electronic medical records. Next is personal management. Personal management in pretending to the staffs of that particular institution, that is following of their biodata accounts, everything. So in conclusion, it is very clear that every nurses play a role in ensuring that innovations are effectively implemented and adopted. So we as a nurses has to have a continuous learning in order to provide a comprehensive nursing care to the patient, and also use the advanced technology in our nursing care, and also do a evidence-based nursing practice and improve the research. So far we have discussed about innovations in nursing pertaining to education, administration, management and research. So if you have any doubt, kindly drop down in the comment box. Thank you for watching.